All right, guys, welcome back to another session from DesiPod and live from DesiPod Studios. Today, we are going to be talking about an area that's touched most of us, either directly or indirectly. But coming from our community, there is much taboo and much stigma around it. It is about mental health. So, without further ado, what do we feel about mental health? Do we feel it gets recognized in our community, boys? Do we feel we understand it? Do we feel our elders actually know in terms of what the modern literature says about mental health? And I turn to you, Abdurrahman, first.
So it's an interesting one. I think there's a social aspect, and then there's also an Asian cultural aspect, which I'm happy to talk about a little bit. I think from a social standpoint, there is this issue around mental health, right? So what actually constitutes mental health? Is it the more kind of severe conditions? Is it what would, relatively speaking, be considered minor conditions? So general anxiety comes under that as well, right? So if a person is consistently anxious, then that, if it's not untreated or if it's not controlled in the proper way and the person doesn't get the right amount of support, those kinds of things can develop into quite a severe situation where a person is feeling anxious most of the time, right? So you can imagine the level of stress and the level of discomfort that might cause the person. So there is an issue around actually what conditions, if I can use that term, constitute mental health. And I think there might be some people out there that actually think, well, actually, I am anxious, I am depressed, I am feeling down more often than not, but still, it's a minor condition. So therefore, I'm not going to seek help. I'm not going to talk to friends. I'm not going to talk to my work colleagues or get help from my manager, whatever it might be, because they don't consider it to be a severe condition. I think nowadays, over the past years, there's been a lot more attention paid to mental health, both socially and professionally, right? So I think there's a lot of workplace organizations that are giving mental health its due in terms of attention. But I think there's a lot of people out there that still consider it a bit of a taboo and think, well, actually, it doesn't quite affect me. Within the Asian community, it's hard to say, because if it's a social issue, then it may very well be a cultural one as well. So, for example, when I was growing up, I think a lot of our elderly community never really talked about those kinds of things. Never really talked about issues of depression or anxiety, anything like that. Part of me thinks that actually our elders had that really strong demeanor that they were expected to uphold regardless, right? Especially, for example, the men of the household or the people, parents, both husband and wife, mother and father, were expected to always be strong. They came into a country where, it was a kind of a survival mentality, right? That you get through it no matter what, and therefore you don't display those emotions to your children as much and you don't express them to your relatives as much because everybody's in the same boat and everybody just has to get on with it. So I think me growing up, I certainly didn't have any exposure to what mental health could be. It may very well be changing now. The attitudes, social attitudes, cultural attitudes may very well be changing because there's a lot more attention paid to it, but there may very well still be some degree of taboo on a cultural level that I think needs to be talked about.
Okay, thank you for that, Abdurrahman.